Action Medeor, Emergency Pharmacy of the World. Jamal is a 5-year-old boy who lives in a small village in Zambia, one of the poorest nations in Africa. Due to dirty drinking water, he has had problems with diarrhea for a very long time. Normally, such an illness is not difficult to cure. Diarrhea medicines are easily found in any medicine cabinet. Unfortunately, in Zambia, this is not the case. The availability of medicines is limited, and many people do not earn enough money to buy those that are available. Jamal's parents have got 3 children, and they have to decide diarrhea drugs for Jamal or food for the whole family. Jamal is getting worse by the day. Dr. Smith is a medical practitioner who lives and works in Lusaka. Once a week, he visits the surrounding villages with his mobile ambulance. The ambulance is a small van that houses the most basic medicines and examination equipment. He is able to help Jamal, and with the correct treatment, his condition improves very quickly. Dr. Smith got those drugs from Action Medeor. The medical relief organization supplies hospitals and health posts in Africa, Asia, and Latin America with basic drugs and medical equipment. Without this aid, Jamal might not have survived. As Emergency Pharmacy of the World, Action Medeor operates where others don't. All vital medicines are stored at the Tönnesforst main base in the Lower Rhine region. Action Medeor orders drugs at a low cost in large quantities. These are then passed on strictly at cost price. The drugs are sent from Tönnesforst to the countries that need them most. The supply to the poorest regions that can't afford even the most essential medicines at cost is supported by donations. But the work of Action Medeor includes much more than the delivery of medicines. In many developing countries, incorrect storage of pharmaceuticals and undetected fake medicines make it difficult to ensure uninterrupted healthcare. For this reason, Action Medeor supports the education of pharmacists. It is their task to secure healthcare provisioning in the future. Action Medeor provides a fast response to emergencies and disasters as well. Earthquakes, tsunamis, typhoons, and humanitarian crises prove a huge challenge for healthcare organizations. Action Medeor's medicine warehouse stores huge quantities of emergency provisions, so that in the case of a catastrophe, the most needed provisions can be dispatched to the affected regions within 24 hours. With the assistance of local organizations, those provisions also reach remote and inaccessible areas. This emergency aid is mainly financed by donations from the general public. Action Medeor helps everywhere where medical aid cannot be taken for granted and provides vital healthcare in the poorest regions of the world. Action Medeor helps everywhere where medical aid cannot be taken for granted and provides vital healthcare in the poorest regions of the world.